Greetings, I'm Doug Schwinn. This is the fifth step in the March-E algorithm, hypothermia. The H in the March-E algorithm is for hypothermia management. The primary focus of this part of the algorithm is preventing hypothermia by keeping the patient warm and covered as much as possible. Only expose the patient to reassess interventions as necessary. Hypothermia protocols are mainly dependent on what is available given the situation, but even makeshift hypothermia prevention efforts are better than nothing at all. Hypothermia prevention guidelines. Minimize the casualty's exposure to the elements. Replace wet clothing with dry if possible. Get the casualty onto an insulated surface as soon as feasible. Cover the casualty with a blizzard blanket or reflective shell. If the items mentioned on the previous slide are not available, use dry blankets, sleeping bags, knit hats, gloves, or anything that will retain heat and keep the casualty dry and warm. Okay. You just saw the slideshow on hypothermia management. One of the most important things to remember is preventing hypothermia before it becomes an issue. Once hypothermia sets in, it's very difficult to treat. On the table before me are some different ways to manage hypothermia. We'll go through some of the more common ones for EMS personnel as well as civilians alike. All right, so the kit I have here is a military hypothermia prevention and management kit, or HPMK. This particular kit comes with two items. First, it comes with a heat reflective shell that has a built-in hood, and it has Velcro closure all the way around the patient to keep heat in. It also comes with a self-heating shell liner, or a ready heat, which I'll show you next. While this is primarily for military use, it is very applicable to civilian EMS, and there are a number of civilian EMS kits for hypothermia management. Okay. So this here is a ready heat, or a 6-panel heated blanket. It's oxygen activated, so once you take it out of the package and shake it, there's a chemical reaction in each of the sleeves, and it will produce heat. This is included in the HPMK kits that the military uses, but there are also some in civilian EMS as well. All right, lastly, I have here a civilian version of an emergency blanket. It's also reflective, keeps the patient's body heat in by reflecting it back on itself. It's incredibly lightweight, very small. It's available to anyone. You find them mainly in adventure stores or outdoor stores. This particular one is a large for an adult. It also comes with a hood. The drawback to these is they're generally flimsy and they're not medical grade as far as durability, but they're pretty good if you have nothing else.
Preventing hypothermia is extremely important for the casualty. It's not just about keeping them warm. It may also save their life. Casualties can become hypothermic, which worsens bleeding. To prevent hypothermia, minimize the casualty's exposure to the elements and keep protective gear on or with the casualty if feasible. Replace wet clothing with dry if possible. Get the casualty onto an insulated surface as soon as possible. Apply the Ready Heat blanket from the Hypothermia Prevention and Management Kit, or HPMK, to the casualty's torso, not directly on the skin, and cover the casualty with a heat reflective shell, or HRS. If an HPMK is not available, the combination of the Blizzard Survival Blanket and the Ready Heat blanket may also be used. If nothing else is available, use dry blankets, poncho liners, sleeping bags, or anything that will retain heat and keep the casualty dry. Warm all IV fluids if possible. The Ready Heat blanket can produce temperatures reaching 104 degrees Fahrenheit for several hours and work for up to 8 hours. Avoid direct contact with bare skin as thermal burns are possible. Keep top or t-shirt on and place Ready Heat over the fabric. Ready Heat blankets may not work as well at high altitudes. The lower partial pressure of oxygen at high altitudes may not be enough to sustain the chemical reaction required to generate heat. Remember, we're not talking about hypothermia in the usual sense, which is dying from cold exposure. We're talking about keeping your blood clotting system working. Casualties in shock are unable to generate body heat effectively. Even a small decrease in body temperature can interfere with blood clotting and increase the risk of bleeding to death. Hypothermia is much easier to prevent than to treat. In summary, minimize the casualty's exposure and keep protective gear on if feasible. Apply the Ready Heat blanket and cover the casualty with a heat reflective shell. Warm IV fluids if they are required. And prevent hypothermia before it happens.
This completes the fifth step of the Marchi algorithm, hypothermia management.